congestive heart failure. And ACE inhibitor ARB is also the drug of choice for patients with CKD to retard CKD progression. So RAAS should not be missed in this group of patients. But nowadays there are also newer agents. For example, this sacubitril valsartan combination, where it is an RNA, which is an angiotensin receptor neprilysin inhibitor, isn't it? Right? You call it Entresto. So the paradigm, right? Paradigm heart failure study done on this Entresto actually proved that, or actually shows that patient taking Entresto versus enalapril can actually retard the CKD progression, which means the drop of the eGFR over 48 months is going to be slower in the arm on Entresto, which is a sacubitril plus valsartan, compared to enalapril, which is the standard of practice and ACE inhibitor. Even though patients with sacubitril or Entresto have a moderately increase of urinary albumin and creatinine ratio, which means the sacubitril and valsartan actually cause a mild increase in the proteinuria. Okay, however, it still confers some benefit in terms of retardation of CKD progression. Of course, nobody actually know why is it so. There are many lots of few postulation theories that I'm not going to elaborate here. But we have to keep in mind that this may be a potentially important medicines for patients with heart failure together with kidney disease. Yeah. Okay. Next will be cardiorenal syndrome type 3, which is acute renal cardiac, which means an acute kidney problem causing acute heart problem. Okay, so it can be many different pathology. For example, a patient with AKI causing volume overload, sodium retention, cause the patient to go into APO because they are anuric. Then because of the AKI, the patient can develop hyperkalemia and causing cardiac arrhythmias. Then because of the acute kidney injury, the patient having uremia can reduce the cardiac contractility, leading to pericarditis. Right? AKI can also cause systemic metabolic acidosis, causing pulmonary vasoconstriction and myocardial dysfunction. Right? The myocyte cannot contract properly in the situation where the patient is having severe metabolic acidosis. And the renal ischemia, the acute renal ischemia can actually cause inflammatory process and subsequently leading to fibrosis. Yeah. So how to prevent and treat this type 3 cardiorenal syndrome is we have to treat the underlying cause as well. Treat the cause of AKI. May it be due to
Berapa kita berdua, mengapa kini engkau berubah? Sedangkan aku masih kekal setia, mengharap kasih menjadi bintang jiwa. Mana janjimu akan setia, menyayangiku sering malammu.